Hi, everyone. Good morning, good afternoon, good evening, depending on where you are in the world. We'd love to hear where you are in the world. Please do comment in the chat. I'm Catherine Mattice, founder and CEO of Civility Partners. Civility Partners focuses on workforce surveys, action plans for change. Once we have all that data, we do a lot of training, and we also specialize in coaching for abrasive leaders. So just wanted to introduce our services here. We do lots of workshops, coaching, working with organizations to update systems and processes so that a healthy workplace culture can flow, and of course, working with leaders around change management and so forth. So today I have with me Renee Thompson. I'm super excited to have you here, Renee. Renee's
you.
famous. Renee is one of LinkedIn's top 10 voices in healthcare. And then in 2022 and 2023, she was one of the top 5 nurse influencers on LinkedIn. And you have a company similar to mine, Healthy Workforce Institute, but you focus mostly on or only in healthcare, whereas we're a little more general practitioner. So thanks for being here.
You're welcome. Thank you for having me. And we were talking before we went live that this is such an issue globally that we need even more than just Catherine and myself out there trying to solve this problem of just disruptive behaviors. And so really happy to be on the show and to talk to Catherine about the great work that she's doing, to share a little bit about the great work that we're doing, because people need help right now. It's it's a little sad, but that's okay. We're up to the challenge, and we'll do what we can to help people.
Exactly. So tell me, how did you get into working in this space specifically? I know you've been a nurse for a long time.
Yes, I've been a nurse for 32 years, and I always say I've done pretty much everything that you can do as a nurse. And when I was in a corporate position, really responsible for professional development across the whole health system. I realized that even though I was trying to build all these programs, preceptor programs, new nurse residency programs, I was looking at the student experience, all anybody wanted to talk about was how badly they were being treated by, at that time, the nurses. And it reminded me of my own experiences. And then I realized it didn't matter where I worked, what organization I worked for, or what role I had. I swear there was always someone who made it their mission to make my life difficult. And I thought, you know what, working in healthcare is hard enough without worrying about your coworkers making it harder. And really, in a moment, I said, enough is enough. I have to do something about it. So took a leap of faith, quit a great job that I love to start a company to actually tackle this problem that's been so prevalent in healthcare, bullying and incivility, because it impacts everything, especially those patients. So 12 years later, we're a growing company, unfortunately, but that's what we do. We only tackle disruptive behaviors in healthcare alone. We don't go outside of healthcare.
Okay. And what, I know there's this phrase, nurses eating their young. What is it about? Where did that come from? Why do nurses do that? Is it still as prevalent as it used to be? What does that even mean? Let's talk about that phrase.
Well, I will tell you, even when you're a student nurse in nursing school, you know that phrase. There's something that happens with nurses that when you start working, especially when you're new or when you're a student, in general, and this is a general statement, not everybody's like this, but the more experienced nurses tend to be really hard on you. It's almost part of that hazing that people go through in college, where I'm going to be really hard on them and, sink or swim, because that's how I learned how to be a great nurse. But what they don't realize that it's actually making these new nurses less competent, and then they end up leaving. And, we've been talking about nurses eating their young forever. But now, Catherine, we eat her young, we eat her old, we eat everything in between. We're just a bunch of eaters. But new nurses are still the most vulnerable.
Yeah, it's so ironic. I don't even know if that's the right word, but that nurses care about people. That's why they're there, but then they're treating each other that way. It's kind of an interesting phenomenon.
Yes, nurses can be so caring and compassionate to their patients, but they can be cruel to each other. And I've experienced it. And obviously with the work I do right now, I see it every day.
Yeah.
Every day. And it's not just nurses, it's physicians, it's the support staff, it's the administrators, the leaders, it's respiratory, it's therapy. I mean, it's really, I always say, if you have humans working in healthcare, you have a behavioral issue. Okay.
Yeah. Yeah.
Everyone.
Where there's humans, there's drama. Give me a couple of examples of what bullying looks like in healthcare, be it nurses or doctors or any of these people. Give us some behaviors.
Yes. Where there are a lot of cliques in certain departments. And so what we'll find is, let's say you're in a department and there's a strong clique. If you're not in the clique, especially the new people, haven't earned the right to be invited to the clique yet. It's very much like middle school or high school, where people will be given the worst patient assignments. They'll be set up to fail. Some nurses withhold information from them to make them look stupid, especially if, they're in the middle of rounds. Okay. And, there's the nitpicking, there's the finding fault, there's the looking for a reason to get somebody in trouble. There's also some overt, yelling, criticizing, arguing. But there's also that covert, and, I mentioned the cliques, exclusion. Everybody gets invited except for the target, who they don't like. There's the silent treatment. I've had nurses actually flat out refuse to take report from nurses they don't like.
Wow.
Or somebody asks, like a new nurse will ask a question about a procedure or a medication, and the experienced nurse says, "Go look it up yourself. I'm not your mother." Now, those aren't maybe bullying situations unless it's repeated over time with the them being the target. But all of this impacts patient care, patient outcomes, and they don't see it that way. And I could give you 1,000 stories and examples about how it shows out, but I always say the bottom line is, the way we treat each other is just as important as the good care that they provide, but they don't always see it that way.
Yeah, yeah. So I did some training for I talk about this a lot as an example, an airline. They manufactured executive jets, and I remember it was interesting to stand over the manufacturing line, and literally the jets are born. They start off as a pile of nothing, and then they're going up and down this line, and by the end, they're adding a wing, add another wing. It's kind of fascinating, but I was thinking if somebody feels bullied, they might miss a screw or something kind of important because they're distracted. Yes. And now we're talking really about the lives of the people on that plane. So similar in healthcare, that if I'm distracted by my feelings or I'm not sleeping because I am dreading work, that I might make a mistake on meds or what have you.
Happens all the time. And I always say that if somebody, we talk about having strong personalities, or if I'm new and I ask an experienced nurse a question and they make me feel stupid.
Yeah.
I can't believe you don't know that, or they're very condescending. Chances are when I'm in a situation like that again, I'm not going to ask, and I'm going to wing it.
Right.
Because I don't want to be embarrassed like that again, especially if it was, done in front of other people. And that's the last thing you want, is somebody new winging it when it comes to taking care of your mother. Okay.
Yeah.
So, frequently, we can actually see the direct line to patient outcomes when somebody is treating somebody else with such cruelty.
Yeah. So what should leaders be doing if I'm the nurse manager, the floor manager, or some sort of leader in this scenario? So yes, there's the top leaders, but what about those managers that are there working with those people? What kinds of things can they be doing?
Well, Catherine, those are my people. So if you take a look at all the people who we work with, and yes, the executives and the staff and all of them, my sweet spot is working with those frontline leaders, because they are the ones who are truly responsible for their culture.
Yep.
And so we work with them to first get really clear on what bullying is and what it's not. Okay, there's incivility. There's things like being held accountable for your performance or constructive feedback that people say, "Oh, I'm being bullied by my preceptor because they gave me constructive feedback." That's not bullying.
Right.
And so we help them to get really clear on what bullying is, what it's not. We help them to then set behavioral expectations as a team. We do a really good job in healthcare setting performance expectations,
Right.
but a lousy job setting behavioral expectations. So we bring people together and we say, all right, how do we always want to be treated by each other? How do we never want to be treated by each other? And then you create norms for behavior, for conduct. And we do this with the entire team. So physicians and providers. And if respiratory spends more time in your department than they do in their own department, you include respiratory. So whoever is working with your team, pretty much every day, you include them. And then from there, it's confronting disruptive behaviors. And, there's a huge staffing crisis in healthcare. And I know that's in other industries too. So frontline managers are reluctant to confront, especially an experienced, very competent nurse's behavior.
Right.
Because they're afraid they're going to quit.
Mm-hmm.
And I try to help them like, that's short-term thinking. So it's teaching them how to confront disruptive behaviors and then engage their team in ongoing skill development. Because you have this really nice department norms, we give each other feedback, give and receive. We talk to each other, not about each other. Well, just because it's written on a piece of paper doesn't mean you magically know how to do that. So they have to engage in what a lot of people call the soft skills. We actually call them the essential skills.
Yes.
And then finally, you will appreciate this. They have to build a strong partnership with HR.
Mm-hmm.
They have to work with their HR partners to make sure that they're collaboratively working on addressing disruptive behaviors and actually holding employees accountable for their behavior. And so that's the gist of what we do.
That's awesome. We're doing a lot of this same type of thing for sure. I do always kind of crack up a little bit. I talk to these CEOs of, multinational, multi-million-dollar, sometimes multi-billion-dollar, and they've got someone high up there that's bullying. And the CEO, who's clearly assertive and successful, is deathly afraid to tell somebody that their behavior needs to change. Like that person's going to be like, well, fine, I'm going to quit so I can bully somewhere else. That's not what's going to happen.
No, I mean, it might, but that's not the norm. And, I always say, there's a psychological reality that exists in all human beings, and that is we avoid pain.
Right.
We're designed to avoid pain because it could affect our survival. While confronting someone, especially if you're a newer manager and you're 25 years old and you have somebody in your department who's 55 years old, who's been there for decades, it can be painful confronting them. So we do what's comfortable. We do nothing. Yep. And, it's like, you got to have a little bit of moral courage and practice and, have strategies on how you're going to confront them. But it's a skill you can develop.
Yeah, for sure. Yeah. When we take on coaching those abrasive leaders, as we call them, part of the process is coaching that person's boss, often the CEO, to make sure they do have the tools to confront, and recognizing that you're essentially letting somebody walk around with toilet paper on their shoe, and you wouldn't do that. Why would you let them walk around embarrassing themselves with all of their bullying and also allowing them to hurt others? But yeah, it's interesting the lengths that employers will go through to avoid confronting someone because they're afraid that they'll leave or it'll get worse. And it's fascinating.
Yeah, and I get it. I was a frontline manager once, and it was during the last major staffing crisis that we had. I get it. If I didn't have a nurse to work, I was working that nurse's shift.
Yeah.
So when I had somebody who wanted to work in my department, even though they had red flags of maybe with their behavior, I hired them anyway. I was very reluctant back in the day to confront any of my people because I was afraid they were going to quit on me. So there's no judging here. I was
for sure.
I did it, but I didn't. It's because I didn't know how to confront.
Right.
I didn't have the skill set then that I do now. And,
right.
It is something you can learn.
Yeah. And that's the thing too. So many companies, healthcare included, I'm sure, don't actually deliver a whole lot of manager training. And if they do, it's likely more technical, kind of like here's how to deliver a performance conversation,
Right.
or here's how to delegate. But what about the essential or necessary skills of like stepping in when somebody's misbehaving and coaching people who are gossiping so they're not doing that anymore, and that how to be proactive in creating a positive environment, because it doesn't just happen. So yeah, what how do you go about engaging people in a culture change when you're working with clients?
Well, I will admit that early on when I started this company, we had a lot of organizations that would want us to come to them and do a workshop.
Right.
And I'd do a 4-hour workshop, or maybe I would do 2 back to back so you could accommodate people. And then I realized bringing somebody in to do a workshop is not going to solve your problem.
Right.
You know, we got to the point where I actually won't do that anymore. If you just say, nope, I just want a workshop, just one workshop and we're done. I say no, because I'm not going to take your money, knowing that's not going to solve the issue. So we like to do, there's a couple of different ways. We do a drip campaign where we may do a kickoff, and do a workshop with we always start with the leadership team first.
Right.
We'll even have organizations say, we want you to come in and work with our staff. No, leaders first, because they're responsible.
Right.
And then we'll work with the staff. But we might do a kickoff, do a couple of workshops, but then we'll enroll some of their leaders into one of our online programs. And so they get a deeper dive there. And then we have some programs that actually then target the employees, because, okay, you've got the leader who is equipped. Now you got to look at the team and getting the employees equipped. And we have several programs that do just that, but it's a step-by-step process that usually takes a year. So we can do that. We also do a lot of consulting. So we'll go into an organization. We usually work with 3 departments at a time, and we work hip to hip with the leadership team and the employees to completely transform their culture. And we've been doing that work for about 6 or 7 years with really great success. So we're on site with them. We're working with them virtually. We implement it. We have a system that we utilize. And it's been really nice to see such transformation in some of these departments. My favorite story, favorite is this was about 4 years ago. We were working with the hospital, and I had a call with one of the leaders who we were going to be working with her department. And I got on the phone with her, Catherine, and she cried. She said, my staff hate me. You know, I walk in the break room, they all walk out. You know, they won't tell me anything, but they'll file a complaint anonymously with, corporate compliance. And she just went on and on. She's like, I don't know. I know I'm supposed to be working with you, but I'm looking for another job. Well, we worked with her, and I'm happy to say she's still there. She completely transformed her department. And she's so funny. She'll say, I am the face of healthy workforce, like healthy, everything is healthy workforce to her. She said it transformed her life too, and now her team are the ones who are continuing to sustain this momentum. But it's just a reinforcement that she was hopeless. But then just by giving her the tools, and we implemented a system, she really just, she was amazing. And I know, this, when you go in with working with an organization and you see where they start to where they, finish, it's just, it's great work.
Yeah, those second surveys that we do at the end of a year or 18 months often is pretty awesome to see that. I'm curious, talk to me a little bit. I love case studies, a little bit more about the system. So what are you doing when you're working hip to hip? Were you coaching her, and she was going to, tell me more?
Yes. So we call it our Department Culture Change Initiative. And we always start when we do a baseline assessment. We ask questions tell me about the relationship with your leadership team, relationship with physicians and providers. We have a 15-question validated survey tool. It's 15 behaviors. and how frequently they witness or experience, because way more people witness bad behavior than experience it.
Right.
And then we ask general culture questions. And so we have 3 data points. We do the baseline, and then after we do the intervention, we assess again, and then a short time after that. But we first start with the leadership team, and we equip them. So they go through one of our foundational online programs called Eradicating Bullying and Incivility, Essential Skills for Healthcare Leaders. We do a variety of intake surveys with them. We get to know our leaders. And then from there, we have phase 1 is we do a kickoff, and we heighten awareness. So we're on site, we do a big kickoff, and we spend about 6 to 8 weeks heightening awareness. One of the reasons that we see more bullying and incivility in healthcare, it's more than any other industry, is because we've normalized deviant behaviors. Oh, that's just the way they are.
Right.
And so
they're just passionate.
Yeah. They're a great physician, just, don't get on their bad side, or, they're a great fill in the blank, but then, they're not so great.
Yeah.
So we heighten awareness. You can't expect somebody to adapt their behavior unless they're aware their behavior needs to be adapted.
Right.
So we have a variety of ways that we do that. And then we get very intentional about the type of culture that they want to create. And that's where we set those, we create those department norms for them. From there, in phase 3, we do skill development. So we have very targeted skill development, assertive communication, honest and respectful, how to reduce gossip, how to give and receive feedback. And then finally, in phase 4, we give them strategies that they can hardwire and sustain a new norm, because I'm sure you know this, if without strategies to hardwire healthy workforce best practices into the very fabric of your department, your organization, you'll slip right back. So we have strategies for that. And it works. It's slow. I always say your culture didn't get this way overnight. It's not going to change overnight.
Right.
But, when we follow this process, I always say, trust the process. Trust the process.
Well, that triangle that I showed earlier probably resonates with you. Yeah, you can't ask people to change behavior if the organizational systems aren't there to facilitate the change and acknowledge the change and hold people accountable to the change. So
absolutely, because we include the executives in all of this too. So we meet with the executives like every 6 weeks. We make sure that they're getting the support that they need. We work with HR. HR is a big part of it. We don't do any of this work without HR. We make sure that physicians and providers are included. So it's really, you got to look at it from an organizational perspective, even though we might only be working with a few departments at one time. Yeah,
for sure. That's the thing. It's organizational development and change. Any thoughts or quick advice for anybody who might be feeling bullied who's watching?
Okay. Yes. People reach out to me all the time saying, I think I'm being bullied. When somebody asks me that, I always say, all right, there's 3 things I'm looking for. Are you the only one being treated this way? Or is this person treating everybody that way? So are you being a target? Is the behavior harmful, and is it repeated over time? And if that's the case, the first thing I always tell people, because people are afraid to confront, is at least start a documentation trail. Just start documenting. Hey, this happened this day, this time. This is what, if you can use verbatim comments, use verbatim comments. Okay. Well, are there any witnesses there? Start a documentation trail. There are some confronting techniques. One of them is just name the behavior. You're yelling at me in front of people. You just called me an idiot in front of people. You just name the behavior, but then find someone who you feel is safe, who you can talk to, because we find, I think the last statistic I saw was 40% of all targets of bullying don't tell anyone. And they suffer in silence. So start a documentation trail. That's easy. That doesn't require any discomfort. Okay.
Right.
Learn some, confronting techniques. Just name the behavior. We're big on scripting. Love scripting. So when they behave a certain way, like, here's a script, and then talk to somebody who you feel safe and get the support that you need.
Yeah, I would agree with all of that. Yes. And Definitely documenting who, what, when, where, why, who saw it, what happened, what time was it, and then
Yep.
you're going to come across, and I guess this is unfortunate, but HR, needs you to help them make a business case. So having all that documentation that's
Yep.
very real and unemotional is what they're going to need to kind of get permission to do something about it. So if you're very factual on this day at this time, this is what was said and what happened, and they called me an idiot and a bunch of other things over and over again in your journal, that's a lot more helpful for HR. And I know I'll be curious about healthcare. I know HR can get a pretty bad rap. In fact, there's even research articles, in peer-reviewed journals where HR made it worse and all of these things. And as someone who came from HR, I was in that position. People were complaining to me and there was nothing I could do. I spoke to the president about it often, and he was just, that's how he is. Why does it bother you? Let it go. And I'm like, well, it's not just me. Lots of people, every time someone quit, another person's quitting in his department. Are you going to talk to him? And he would say, well, this was never going to be their career anyway. It's just like always expensive. And so I guess my question is it the same in healthcare where HR is getting a bad rap for making it worse, when really I think a lot of the problem is they can only do what they have permission to do?
Yes. I absolutely believe that HR and the leaders, they want the same things. They want a safe environment for the employees, for the patients, in healthcare. And what I have found a lot is, from the leader side, I hear it all the time. I go to HR and, they're like, oh, well, did you counsel this person? How many times did you counsel this person? Only 5 times. Oh, you need to counsel them 27 times before we can do anything about it. Or it's like, I hit a brick wall. Yeah. But then I talk to HR, and HR tells me I have a leader who barges into my office demanding I approve a termination or some significant corrective action. I've never heard about this employee.
Right.
There's no documentation. And when I look at their performance reviews, the last 15 years,
they've been great.
Exceeds expectations. So what do you want me to do? Now, I will say, Catherine, I have experience. I'm actually dealing with this right now with a client where the lens that HR views all of this with employees is they look at risk to the organization. If we terminate this employee, what's the risk? So they are risk averse in general. That's a general statement.
Yeah.
And so they are going to make sure that the leader does their due diligence, that it is kind of safe to terminate somebody if it gets to that point. And therefore, they kind of get a bad rap. People make a lot of assumptions that HR is not doing anything. And you and I both know that may not be true. It may be true.
Right.
But most likely it's not true. And that's why we always from the beginning partner with HR and make sure, okay, at what point do you give HR a heads up on something and involve them? And I've told leaders, let's say you want to terminate somebody, go to HR and say, this is my goal. I need to terminate this person. What do you need from me to make it stick?
Yeah.
And work with them.
Right. So,
I
think, that's something that is on my list of things that create risk for organizations, because and that's something too, HR is absolutely risk averse, but they're always kind of looking at the legal piece. But there's so much research that, a homogeneous workplace or workforce is risky. A younger workforce is risky. Like there's all these organizational culture things that facilitate. But I think, or I know HR needs to get better at presenting themselves as coaches for managers. Come to me and ask for my help and I'll coach you through it. And that way they can be sure the right documentation is happening but of course, I think that's a lot of time that's not what's happening. And there's a big wall between HR and the people and the employee and the manager. So
you're so
I
right.
know we could talk all day, but we don't have time. But I did want to share a couple of things. One, if you head to our website or email, my team will send you this culture calculator. Speaking of HR, I know often they do have to make a business case to address things. So wanted to offer that up. And also this presentation gets half of a credit for your continuing education. So there's the activity ID. Jenny, my marketing manager, will be so proud that I've figured out how to do the slides and everything finally after probably about a year. Anyway, thank you so much, Renee. I really appreciate your time.
You're welcome, Catherine. Really just happy to have a conversation with you. You've done really great work in this space. And so, as I said earlier, we need more of us out there who are helping organizations address workplace bullying and incivility. So thank you. Appreciate it.
Yeah, thank you. All right, everyone. We'll see you next week. Thank you.
Bye.